Hi, I'm Dave Derrick. I'm lead physiotherapist for the Northwest Ventilation team here at Wythenshawe. I'm going to talk you through the features and the functioning of the Cough Assist E70 machine today, and then we'll do a practical demonstration on a model patient for you to see. So starting at the back of the machine, you can see here this is the power cable. Pulls out and it pushes in place. Okay, so make sure you do push that in firmly to get a proper seal. There's also a filter on the back which just protects the internal workings of the machine. It will come out, it can be washed once a month if required, okay, left to dry, and then it just gets replaced again like so. We've also got tubing, okay, and a mask interface, which is what we use to deliver the Cough Assist therapy. So I'll start from this end here. You can see you've got a filter. This is a bacterial filter which just protects you and the patient when you're using it from any bugs that might be being drawn in from the environment, and also from anything that you might cough out, any bacterial bugs being drawn into the Cough Assist machine itself. This should be changed on a once monthly basis or more regularly if required. You can see it just pushes into the tubing like so. It is a little bit fiddly, but it's just going fairly easily once you've got it there. We've got tubing here, which is the standard tubing that we issue to patients. Don't be alarmed if you do get through the post some grey coloured tubing. It works exactly the same way, it's just a different type, different brand. The other end here, you've got a face mask, which is what you would use to apply it over your nose and mouth. And there's also a connector piece here, okay, which just allows you to attach the face mask onto the end of the tubing. So, at the side of the Cough Assist, there is a connection port, and this is where you would attach the filter end onto the Cough Assist. Just make sure you push and twist and that locks it in place. Okay. It's really important that you don't use the Cough Assist without that filter in place. Okay. If you need any spare filters or you need any replacements, please just let us know and we can send some out in the post to you. Okay, so now we've got the tubing all assembled and it's connected onto the Cough Assist machine. I'm going to show you how you switch the device on. You see at the front of this device here, there's a little green symbol. That's the on-off button. Very easy, you just literally will press the on button and it turns the device on. Just ignore this little switch at the side, you don't need to be aware of that. It doesn't do anything. Two other buttons which we need to be aware of. One that says settings and one that says therapy. A few other points you'll notice as well too, there is a little number in the corner here, it says number 1, and it also says the particular mode that the Cough Assist machine is in. I'll talk in a little bit more detail about the different modes that we have in the Cough Assist, okay, presets, in a short while. We've also got here the setting, the time, the date and time, and in the corner you can see here there's nothing. If you do ever notice that there's a little padlock which is unlocked, please do give us a ring straight away. On the front here you've got the inhale settings and the exhale settings together with a pause time if that's set for you. These are the same settings that are on the prescription issued to you by your physiotherapist. So I'm going to talk to you now how you change the different settings. So, as I mentioned before, the device has different memories, so different presets, and we can set up to 3 different presets for you, 1, 2 and 3. Again, your physiotherapist will tell you when you should be using those different presets when they assess you. Okay. To change between the presets, what you do is you press settings and you see it highlights in green preset. I then press modify and it then highlights the number that's in this green box here. I can change between 1, 2 or 3 by scrolling up or down. So say I want to go from number 1 to number 2. I scroll up to number 2 using these edit keys and I press OK to confirm. Once I've done that, you'll see in the corner here it says it changes to number 2. If I want to go back to number 1, I'll again follow the same process. So modify, highlights number 2, and I move the edit keys down to number 1, and I press OK. then finished, so I press finish and it goes back to that screen. Always check, however, that the settings on that to match the prescription that was given to you by the physiotherapist. So this is Kate, who is one of our physiotherapists. She's kindly agreed to model using the Cough Assist today. Okay. So when you're ready to use the device, you can see here there's the button that says therapy. At the moment on the Cough Assist itself it says standby. Now if I press therapy, you'll notice there's a change in sound, but also it goes from changes from saying standby to having a little green bar now. I'm just pausing that for a moment so you can hear me. Now when we come to deliver Cough Assist treatment, okay, it's really important that you have the mask on appropriately and it gets a really good fit. So we have two different size masks that we use. One is a yellow, which is a smaller size, and the green is a slightly larger size. Your physiotherapist, when they assess you, will provide you with the most appropriate mask to fit your face. So when we come to use the device, as I say, we'll switch it on. Place the mask over the nose and mouth. Now, the easiest way to do this is if we go for the bridge of the nose, we point it down, okay, like so, and we roll all the way down. We grip either side and we push firmly on. You'll notice I've got one hand on the back of Kate's face, so I get a really tight seal. Okay, Kate, so we're going to use the Cough Assist now to help clear your chest and any secretions that might be in the lungs. So what the machine is going to do is it's going to help us to take a deep breath in, followed by a really deep breath out. If you can do, I'd like you to breathe in for a count of 2 as we set the machine, okay, and then cough on the breath out. So let's switch it to therapy now. Place the mask over the nose and mouth, like so. Get a really good tight seal, so breath in, 2, and cough, 2. So breath in, 2, and cough. What you're noticing in between each breath and lifting the mask off, you can leave the mask on over your nose and mouth if you wish to, but sometimes this can be a little bit more comfortable just to have a breathing in between. Do one more, so breath in, 2, and cough. And obviously if you have any secretions in your mouth, you can then have a spit them out. If you have a suction at home, you can clear those with suction. Your physiotherapist will set the exact time of the breath in and breath out, and that's individualised to yourselves. So just make sure you follow the prescription that's been set for you. And again, the number of breaths that you do per cycle will be individualised by the physiotherapist. So again, just follow the set prescription that way. So at the end of your treatment, your physiotherapist may recommend that you finish off by having some deep breaths. If that is the case, follow the prescription that's been set for you. We usually tend to set preset 2 for the deep breaths mode, so I'm going to change it into preset 2 using the same technique that I showed you earlier on. Okay. So you see it's a number 2 now, and it's just got the inhalation setting and the exhale setting that isn't on there. Okay. So now, Kate, what we're going to do is we'll finish off by giving you a few deep breaths at the end of the treatment. So I just want you to breathe in through your nose and mouth and just pull down. Okay. So switch into therapy mode. In, 2, final one now. In, 2, just going to pop this into standby mode now. Thank you for that, Kate. So that is the end of today's video on the Cough Assist. If you require any further information, please don't hesitate to contact the North West Ventilation Service. Remember, we will issue you with some written instructions on how to use the device, so this video just sits alongside those instructions for you.